Coming up next on It's Personal, brought to you by Andersen Health System, enterovirus has hit the Midwest. How soon will it be hitting the La Crosse area? We'll find out. Falls might be caused by your dog or cat in your home. It's a big problem in the United States. We'll have an expert to explain how you can learn more. Also, food choices. Your food choices might actually be affecting a good night's sleep. Learn all about it next on It's Personal, brought to you by Andersen Health System.
Here's some news that should be as comforting as a teddy bear. Andersen Health System surgeons perform surgeries with barely a scar. They use minimally invasive techniques whenever possible, so there's less pain and much smaller scars. It also means a shorter hospital stay and quicker, more bearable recovery, so you can get back to living your life. To learn more, talk with your primary care provider. Call Gunderson Surgery at 608-775-2331 or visit gundersonhealth.org/surgery.
Welcome back to It's Personal, brought to you by Andersen Health System. I'm Chris Stauffer. Well, there's a new thing to, I guess you could say, worry about for moms out there. It's a virus, a respiratory virus called enterovirus. Joining us now to talk a little bit more about this and to kind of get to the bottom of this is Marilyn Michaels, and she is an infection preventionist here at Andersen Health System. Thanks for joining us, Marilyn. Talk, if you would, first of all, about what is enterovirus and where is it?
Enterovirus, well, entero means that it's from your intestinal tract. So actually the virus is in the intestinal tract, but it could also be in your respiratory secretions up in your mouth and your nose, the tears. So it's a virus that, because it's in the intestinal tract, you have to be very careful about diapering, toileting children. It's easily spread by toileting practices, and then you ingest it, and you're able to transmit that infection to other people through that route.
We're hearing more and more about this in the news recently. It's sort of gaining some attention because it's in the Midwest.
Exactly, and it took off quickly. Now, enteroviruses are a very common infection. There are millions of them every year. Okay. And at the start of the school year, you'll start to see children coming home because they've got the summer cold, sore throat at the start of the school year, maybe some diarrhea, some vomiting. They just look a little puny, but not horribly sick. And many of those are enteroviruses, or they may complain about a headache the first couple of weeks of school and feel warm. Not horribly sick though. It's the summer cold along with some of the other symptoms.
So these are sort of different levels, but it affects kids in different ways, and this seems to be mainly impacting the pediatric population. I could be wrong about that.
No, you're right about that, and there's many strains of it. So the particular strain that is starting to circulate now in the Midwest has resulted in severe respiratory infection presentation. And about a fifth of them will have a fever along with that, so they may not have a fever. They may be complaining of the runny nose, and it's not a concern unless they start having that severe respiratory distress presentation. That's where you need to be concerned. If they're complaining that they're having a hard time getting their air and you start to see that they're breathing more rapidly, that's when you need to be very concerned.
We're talking with Marilyn Michaels. As I mentioned, she's an infection preventionist at Andersen Health System, also a nurse. And as a nurse, what would be your advice then to moms? Obviously, they're going to be watching out for anything when it comes to their kids, moms or grandparents. What should they really be doing? Should they be taking any sort of precautionary measures?
Well, being watchful. You were right by saying that. You need to watch your children carefully because it's a rapid onset. But you don't need to lose any sleep over it. You need to keep your home clean. Make sure that there's good separation between where you're diapering your children. If you have children still wearing diapers, make sure that they're washing their hands when they get done going to the bathroom. And this infection can also impact adults. But adults, because we have antibodies by being exposed many times before, we will just have cold symptoms. So even though you're not horribly sick as an adult, that doesn't mean you can't transmit this to a younger child who's going to become more severely ill from it. Because children have a smaller airway, they may react a little bit more severely to this respiratory infection than an adult that has a more mature airway.
All right. Is there any concern for grandparents who might be around kids that are sick? Because we talk about sometimes the suppressed immune resistance. Is there a concern there?
Well, they probably have, some of the antibodies that they had
Okay.
acquired through their lifespan, but, as you become older, typically people over the age of 80, their immune system starts to be a little bit more sluggish, and they might have more of an impact than a healthy adult.
You mentioned good hygiene. I'm going to give you an opportunity here, Marilyn, to just sort of run down some of those things again, besides just the good hand washing. I know that you're a big advocate for coughing into your elbow, for example. A lot of us who are older certainly didn't learn that growing up. I think you and I talked about this not too long ago, that the nuns used to say, make sure you cough into your hands. Well, that's not a good idea anymore.
That's right, because now you touch things with your hands and you're going to be contaminating everything in the environment because you coughed into your hands. Proper technique, and this is what children are learning in school now, is to cough into your elbow, but still follow up with hand hygiene. And if you have a tissue, that's even better yet, to collect all of it. You don't want this dispersal of droplets going into the environment. Try to step away from others if you're going to be coughing and sneezing, and then follow through with the hand hygiene. And hand hygiene should be done with soap and water with this particular virus, because the alcohol gel will not be as effective in killing this germ. So you want to remove the germ from your hands with using soap and water.
Good advice, that's for sure. And again, if you are not feeling well, also remove yourself from larger groups, correct?
Correct. Stay home if you're sick. In this day and age, we have a lot of frail children going to school. And you really don't want to be sending your child to school because it's convenient to you, and exposing these other children that are trying to work into the mainstream. So proper approach to this is, if you are sick, you stay home and take care of yourself and not expose others.
One of the things that I heard you say not too long ago was, even going to the doctor's office, don't be afraid to ask your provider, please wash your hands.
Yes, you need to be protecting your children. And we all need reminders, because as a healthcare worker, we have so many things on our mind that sometimes we just slip up and forget. And that is one of our main campaigns right now, is to follow through with hand hygiene.
Yeah, practice what we preach. Is that right?
Exactly.
Marilyn Michaels, Gundersen Health System infection preventionist and a nurse, and it's always good advice to get some insight on the latest things that are going around. And we mentioned it is the enterovirus. If you feel like you have any kind of symptoms, make sure you call the Gundersen Health System nurses line, and you can certainly find that on the Gundersen Health System website. That's gundersenhealth.org. Again, Marilyn, thanks for joining us. When we come back, we're going to be talking about falls, how to prevent falls. There's a lot of falls that are lurking in your kitchen, of all places. Find out more when It's Personal continues right after this.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
As a cancer doctor, Leah Dietrich wasn't prepared for her own diagnosis.
Really, from the point that you hear those words, you have cancer, your life changes. I felt a lump, and I did what I tell my patients to do, but it was aggressive. The result was a double mastectomy, chemotherapy, and reconstructive surgery.
Always a proponent of early detection, she became even more of an advocate.
I've always told patients and informed them about the benefits of mammograms and self-breast exams. I think I'm even more passionate about getting that message out to my patients and to the community.
As a leader in breast cancer awareness and treatment, Gundersen provides expertise and a level of care that is unmatched in our area.
I've tried to use my experience to help other people, help them know that even though it seems tough, we're going to get through it.
Gundersen Health System, where caring meets excellence. For more of Leah's story and to schedule your own cancer screening, go to gundersenhealth.org/cancer.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Falls in the home, much more common than you might think, but there is a way to avoid them. Joining us to talk a little bit more about that is Kim Lombard. She's an injury prevention specialist at Gundersen Health System. Hi, Kim.
Hello, Chris.
Let's talk a little bit, if we can, about falls in the home. All too common. What happens? Why are so many falls happening in the home?
Yeah, so I mean that's the environment where most people spend their time, is in the home. Sometimes there are so many different components that play a part when a person falls. They might have issues with their vision. They might be on multiple medications that put them at risk for falling. There's so many different components. But we definitely want to make sure the home environment is safe, and people might need grab bars. They might need assisted devices. But more importantly, we want to make sure that the home is free of any clutter, anything that they might be able to trip on. Small animals or pets kind of play a part too. So it's really important that the environment that they're in is a safe environment.
We want to talk a little bit about an upcoming class where people can really learn more about their particular own issues, their own home, and what they can do. But you mentioned pets as a hazard. Just reading something recently from the Center for Disease Control, says falls are the leading cause of non-fatal injuries in the United States, and in 2006 nearly 8 million people treated in emergency departments for fall injuries, but about 86,000 of them from dogs and cats. People don't think of their pets as getting in their way of something that they're going to be tripping on, but it seems to be a bit more of an issue than maybe most of us even had imagined.
Yeah, so it's happening, and it does happen. I've even spoken to people specifically who have had a fall by tripping over their dog or their cat. Sometimes the animals just get in the way of our feet, and a fall occurs. So it really is important. I mean, we don't want to give up our animals because they're important for our social, our emotional aspect. They do a lot for us, so we definitely wouldn't want to get rid of them, but there are things that people can do. And one of those things is just to be aware that they could potentially be a fall risk if you have pets, small animals or even large animals. And then we just want to make sure that, one thing that they can do is just make sure that they're trained with the obedience, and that they are, they have the option to just be trained. So that would be a definite benefit.
Yeah, certainly obedience training would go a long way, I'm sure, in making sure the dogs are aware of the particular location that their owners are in, or cats. I don't know if cats are as easily as trainable or not. Let's talk, though, a little bit about other things that people can find in their home. Some common things that you might just not consider as being a potential risk at tripping over or falling from.
Sure. So we kind of touched a little bit on clutter, just making sure that the home is free of any clutter. Sometimes people might have difficulty on stairs. So if, for example, there's laundry units in the basement, you might want to look at actually if there's an option to move the laundry to the upper level, that would be recommended. But there's definitely strategies that people can learn, and that's why we do hold a course at Gundersen to help people kind of work through those strategies. There's lots of information and really important tips and key points that we can instruct them on.
Now, this just isn't a one-day course. This is really a learning process, and is over several weeks. Talk about that.
It is recommended. Because falls is so complex, there's so many different reasons why people fall. So pretty much all of those reasons are included in the 7-week course that Gundersen teaches. And so they're going to learn about lots of different things, like your vision. Sometimes as we age, our vision changes, and so it's really important to pay attention to those things. Medications. sometimes even knowing how to get up from a fall. So because falls are so common, they might not always result in injury. However, people might be stuck on the ground. They might lack the upper body strength to really get themselves up. So we even do an exercise around getting up from a fall and teaching them how they can go about doing that, even if they lack that upper body strength.
We're talking with Kim Lombard. She's an injury prevention specialist at Andersen Health System about a 7-week course that's coming up on October 6th. The classes are from 9 to 11. And if you'd like to learn more information about it, you can certainly go to gundersenhealth.org. Talk about strength a little bit, because strength training, a lot of people don't think about strength training and correlate it to falling, but strength training is really a part of this course.
Yes, and that's probably one of the main reasons why people fall is they simply lack balance and strength. So over time, if we don't use it, it's totally true. If we don't use it, we lose it. So that's why people, as we age, have problems with mobility. They notice their balance is a little off. Even maybe starting at age 30, 40, it happens way sooner than we actually think. So in this course, we actually bring in a physical therapist who will introduce a set of exercises to the class. And in these exercises, we focus mainly on building upon strength and balance. And what's really cool is that you'll actually notice an increase in your strength. Balance takes a little bit longer to change. However, you can notice if you practice the exercises regularly as they are given to you, you'll notice changes within the first couple weeks of the program. So it's pretty cool to see people coming back, sharing their stories, sharing their experiences, and how, wow, I couldn't do this before the program, and now I can actually do this. And these are everyday, we need our strength and our balance for everyday activity, getting up from a chair, walking sideways. We have to have our balance. If we're going into church and we need to walk narrowly through a pew, or at the movie theater, that's everything that this course is gonna aid these people with.
So it's not just in your home.
It's not just in the home, correct.
All right, let's talk a little bit about avoiding the emergency room, because we said falls are a major problem in the United States, and non-fatal falls is what they're really called. We said I think the year was 2006 that nearly 8 million people were treated in emergency departments. Going to the emergency department is really sort of what you're trying to avoid here.
Yeah.
So this is part of not just a Gundersen effort, but this is really kind of a national effort to prevent falls.
Yeah, I mean it's a major. 1 out of 3 older adults in their lifetime over the age of 65 will have a fall, and sometimes those falls will result in death. So it's actually the leading cause, falls are the leading cause of injury-related death for people over 65. So nobody, it just seems like a silly way to end your life. And it's very preventable. I think sometimes people think falling is just a natural part of the aging process. It is totally the opposite. It's preventable. There's definite specific things people can do to prevent it. And one of the indicators of falling is of repeat falling is already having a fall. So one fall would definitely be an indication that you might be at risk for future falls. So we totally want to help people with that. We want to provide the education and the information, and that's what one of our programs does here at Gundersen.
Again, we're talking about a 7-week course starting October 6th. 9 to 11 is the class, and it's at the Andersen Health System Onalaska Clinic. If you'd like for more information, you can certainly call Kim. Her number is 608-775-2011, and again, you can find that information at gundersenhealth.org. This information, the demographic, I think a lot of people are looking at this as, I need to be a certain age before I can go to a fall prevention 7-week course. But this is not just for, shall we say, older folks. It's for care providers as well, and other people who are in a situation to take care of people who may be in a home, or having people come in their door and try and avoid the emergency room.
Yeah, so I can give you an example. So we already have taken some registrations for this course, and we have a mother and a daughter who have registered this time around. I just received a call today too, and it's for a wife who's concerned about her husband falling, so she's trying to get some more information. So I mean, this is concerning. I've talked to numerous family members What can I do with my mom or my grandmother, and she's having falls, and it's concerning for people, it's scary, and that's something we can do, is offer them that support, offer them those resources, and then really get them the help that they need.
Besides the pain of the injured wrist or arm or hip or whatever it might be, it's just the fact that you're trying to avoid those healthcare costs in and of itself as well.
Yeah.
Kim, thanks for joining us today. And again, if you'd like more information, you can certainly go to the Gundersen Health System website. That's gundersenhealth.org. You can call Kim directly and leave a message for her, if nothing else, and that's 608-775-2011. And again, the details of the class they start October 6th. It's a 7-week course, and it's from 9 until 11 a.m., and that's at the Gundersen Health System Onalaska Clinic. Coming up next, food and sleep. Food may have a bigger impact on your sleep at night. More when It's Personal returns.
Are you confused by all the talk about the healthcare marketplace and insurance exchanges? There's just one thing you need to remember. Gundersen One. It's a new option from Gundersen Health Plan, which is locally owned and operated. If you need to purchase health insurance for yourself or your family, Gundersen One offers a choice of plans to fit your budget. To learn more or to enroll, visit gundersen1.org or call the Gundersen Health Plan Enrollment Center at 608-775-8092. That's 608-775-8092.
As a runner, Michael Bodie thought he was pretty healthy. However, his family history had something different to say.
I ran a half marathon, and 2 months later I had quadruple bypass. One artery was 90% blocked, one was 98% blocked, and one was 80% blocked, so they said, we have to do surgeries. That same day, the surgeon came in.
Like a true champion, Michael found a way to quickly get back in the game.
The minimally invasive route was attractive to me because it offered me at least a chance to possibly recover quicker and get back to my normal life faster than I would have been able to with the traditional surgery.
A leader in minimally invasive cardiac surgery, Gundersen provides expertise and an unmatched level of care.
The folks at Gundersen are rock stars. 2.5 weeks after my surgery, I started in cardiac rehab and actually ran on the treadmill. And a year later, I ran another half marathon.
Gundersen Health System, where caring meets excellence. For more of Michael's story and to learn your risk for heart disease, go to gundersenhealth.org/knowyourrisk.
Welcome back to It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. When it comes to sleep, is food having an impact on your good night's sleep? Here to talk with us about that is Ivy Andersen from the Gundersen Health System Sleep Lab. And Ivy, the first question we have to ask you, is food a factor when it comes to bedtime?
Well, typically it can be, especially if you eat too much right before you lay in bed. And one of the things that we see a lot is if you have a late night snack that's real heavy in calories, or if it has a little bit too much spice, then you can start to have heartburn problems, which can definitely keep you up and cause difficulty falling asleep.
I know there's a lot of people, though, that say, hey, I just had a big lunch, and now I go back. It's hard to motivate when you go back to work. It's making me tired, groggy, and that kind of thing. It seems like it's kind of counterintuitive when you say, I'm tired after lunch and I had a big meal, and now you're saying, no, before you go to bed, don't have a big meal.
Yeah, well, that's an interesting question because, it brings up the siesta, which is the typical nap after lunchtime. And that's not necessarily a bad thing, but part of what people are experiencing after they have a big lunch during the day is that our normal circadian rhythm kind of takes a lull right after lunchtime, around 1 to 2, where you typically are a little bit more sleepy at that time of the day, regardless of the meal that you have. But certainly, if you have a meal that's higher in starches or simple sugars, then that can also contribute to a little bit extra sleepiness during the day. And so, one of the things that I teach my patients that have problems with excessive sleepiness during the day is to avoid those kind of snacks, avoid the snacks high in carbohydrates, and eat more meals that have a higher vegetables, fruit content, or protein content, which can help keep the brain more awake than those sugary foods.
Seems I've heard that before. Fruit and vegetables.
And protein.
And protein. How late can a person eat? You mentioned sort of the midnight snack or the snack before bedtime. A lot of people have supper at 4 or 5, 6 o'clock, but then before they go to bed, they want that bowl of popcorn or that piece of cake or something.
Yeah, I wouldn't recommend eating a large snack before bedtime, but actually a small bowl of popcorn is not a bad choice because it has a little bit of starch content and sugar content, and it can maybe help ease them into sleep a little bit. But I would definitely, and a glass of milk. A glass of milk is not a bad thing. So that's kind of another kind of old wives' tale that people always said, drink a warm glass of milk, and it actually has merit because it can help the brain ease into sleep a bit. As far as timing, you want to avoid eating a very large meal, up to 4 hours before bedtime. At least give yourself a couple hours to digest it, because that's really the issue that happens if you eat a large meal that has some high fat content. Then it takes a while for you to digest that food, and you need to be a little bit more awake to digest your food, and then that's what causes problems with falling asleep.
I want to talk to you about a couple of other things too. You mentioned spicy food, and I want to also ask you about alcohol. Talk first of all, if you would, about spicy food, because you mentioned that can cause heartburn and can also maybe keep you awake at night.
Yeah, well, mainly it's because of the heartburn issue, and often spicy foods have higher fat content. They kind of go together. The big spicy, like barbecue ribs, they would tend to have a lot of fat, and so then it just takes your body a little bit longer to digest that. As far as alcohol is concerned, that is not good for sleep.
See, and a lot of people think that that's going to relax me. I have that glass of wine or two.
Yeah, it's that nightcap.
Okay.
It's that nightcap, and there's some truth behind the thought that it does relax the body a little bit. If you have a drink before bedtime, it does help you fall asleep a little bit easier. But the problem with alcohol is that once you digest alcohol and it gets eliminated from your system, that takes about 3 or 4 hours, and then what happens is you get a little bit withdrawal from that relaxation effect, and then it actually interrupts your sleep. So you tend to wake up a little bit more frequently after you've only been asleep for 1 or 2 hours.
We're talking with Dr. Ivy Andersen, the Andersen Health System Sleep Lab. What about water? Some people like to have a glass of water right beside the bed, and is there a fear that that's going to wake you up because you're drinking too much water before you go to bed and you have to get up and go to the bathroom?
Well, that can wake people up frequently if they have to go to the bathroom. So you would want to avoid drinking large amounts of liquids. Any liquids, that would be water, juice, especially alcohol, especially tea or coffee. You don't want to drink those before bed either because of the caffeine content. But certainly if you fill your bladder up, then you're going to have to wake up and go to the bathroom a few times a night, and then that definitely can interrupt your sleep cycle. So typically I would recommend avoiding excessive liquids at least 3 or 4 hours before bedtime. And if you're drinking a caffeinated beverage, I always recommend stopping any caffeinated beverage at least 6 hours before bedtime.
That was my next question.
Yeah.
And that also isn't just for people who are adults, kids too. A lot of times they're drinking that soda, that Mountain Dew before bedtime.
Yeah, kids too. You definitely want to watch the drinks that your kids have, because a lot of things can have caffeine in them that you're not really you don't really suspect, especially hot chocolate. Chocolate has caffeine in it, so you definitely want to avoid chocolate milk at supper time for kids, or hot cocoa beverage at nighttime.
Well, Dr. Andersen, we're just about out of time, but I want to give you an opportunity to also say, what are your biggest tips for someone to get a good night's sleep beyond the food? Going to bed at a regular time. What are the top 3 things that you would suggest?
Yeah, the best tip for getting a good night's sleep is actually just what you said, having a regular sleep schedule. So you if you pick a time to go to bed and keep that routine even on the weekends, then that's the best way for good hygiene. And then the other thing is just avoiding anything very stimulating right before bedtime. Media devices, watching, playing on the computer right before bedtime is not necessarily the best idea to get a good night's sleep.
All right.
So.
Great tips. Dr. Ivy Andersen, Gundersen Health System Sleep Lab. If you'd like more information about sleep, you can certainly go to the Gundersen Health System website, and you can also ask your provider about, if you're having problems with sleep, about maybe a referral to the Gundersen Health System Sleep Lab, and maybe Dr. Andersen will be able to help you out. But that's going to do it for this edition of It's Personal, brought to you by Gundersen Health System. I'm Chris Stauffer. Thanks for joining us.